So kidney 6 point is normally there is the tip of the medial malleolus. From here nearly 1 chun distal to the tip of the medial malleolus, midway between the flexor hallucis and flexor digitorum longus tendons. You can find there is a depression in between the two tendons depression, that point to be known as a K6 point. This is the K6. Then there is the next point is the K7 point. K7 point, normally the K3 we try to find out. This is the tip of the medial malleolus and the anterior border of the Achilles tendon. Midway between these two, the point is kidney 3. From here 2 chun proximal. Proximal means above. 2 chun proximal to the kidney 3 point. The point to be known as a K7 point. Normally we try to find out there is a tibial nerve is there and also tibial artery. Once it touches to the tibial nerve, the patient normally feel the return the current. That means the name itself is the folio is returning the current. Wherever there is the low electricity impulses is happening on the palmar region of the sole of the foot, and that perhaps it causes some kind of the numbness and other related issues. And further, this, since it is the mother point, it is strengthening to the renal system and also it is connecting to the lungs and then kidneys as well. However, once we activate this point, and certainly this is the great activation point for the kidney young as well as to strengthen the renal system as well. Now the K8 point is the most imperative, which is the lower dantian. So 2 chun again proximal from the tip of the medial malleolus, then half chun anterior to the K7 point. This point to be known as a posterior border of the tibia, posterior border of the tibia in the depression. So do you know spleen 6 is 3 chun proximal to this region is spleen 6 and 1 chun distal to the spleen 6 is the K8 point, which is the lower extremities are regulating and controlling point. So therefore this point called as a lower dantian, which is governing to the 4 major organs, that to be known as a spleen, liver, kidney and pancreas. And further we are moving to the K9 point, which is again 3 chun proximal to the K7 point. This point to be known as a K9, that is known as a supine. This is the border of the tibia. From here 2 chun, 1 chun and 2 chun anterior to the border of the tibia to be known as a K8 point. K9 point is the zobin, which is majorly useful for the pregnancy ladies at the time of the 2nd trimester or the 3rd trimester, where the genetic disorder should not be transferred to the infant in the mother's womb. That particular time patient is complaining, I do have the pain on that particular region related to the kidney stones. That time emergency, you can activate the point to be known as a Shui Chuan. That is the K5 point is the C cleft point. Emergency, you can insert the needle on that region. Definitely K5 point किसके लिए? Kidney stones के लिए. However, the kidney stones are there. That is stones to be regulated. That is stones to be regulated by activating the some of the points. You can note down one point to be known as a P3, then the K3, and then K1, P3, then K10, K3, K1. This protocol will be really helpful to treat for the kidney stones related condition. So therefore, by the way, you wanted to activate the point to be known as a K5, also advisable for the emergency point. Then the K6 point to be known as a chai याद रखते हैं, chow high, ठीक है, वैसा कुछ हुआ तो बनाते हैं, chow high. That is K6 point. Where exactly is located? There are the 1 chun distal to the tip of the medial malleolus, midway between the two tendons. The tendons to be known as a flexor flexor hallucis longus and flexor digitorum longus tendons. You just touch and feel. This is the tip of the medial malleolus. Just below to that there are the two tendons. Tendons means those muscles. These muscles called as the flexor muscles. Flexor hallucis longus, flexor digitorum longus muscles. These muscles will become the tendon here. So that tendon to be known as a flexor digitorum, flexor hallucis longus tendons. In midway between the two tendons, which point is located? K6 point is located. That point to be known as a K6, but K6 is the distal point for the sore throat, distal point for the throat and also for the tonsils related disorders, aphasia related disorders, speech dysfunction. But certainly we can activate the K6 point if the insect bite happen, maybe snake bite or something, the insects has been the mosquito bite, we wanted to use as an antiseptic point generally, but it's not totally advisable snake bite or may the serpent. Serpent is the father of the snakes, right? So that will bite it somewhere, need the medical emergency, but however you can insert the needle on the K6 point is advisable for the most of the conditions of the insect bite. So hopefully you know the K6 point is the throat related problem, tonsils related disorders, speech related issues and also to strengthening to the kidney in related condition. Kidney in related condition, kidney yang is different, kidney in related condition and to regulate overall for the menstruation as well. When irregular cycles are there, menstruation is not good, that time certainly you can treat by activating when the girl having the 15 years 16 years he didn't got the puberty, that time to obtain the puberty we can use this point. The excessive menstruation, amenorrhea. Amenorrhea means absence of the menstruation. Menorrhea means is the excessive menstruation. Even that condition to control the periods also we can use, or to regulate the periods also we can use this point. By the way, giving the pressure will be helpful to treat for the numerous condition. By the way, the K6 point is good point to treat for the bowel movements related disorder, even for the constipation and also the rectum related problem can be treatable by activating the K6 point. Now coming to the K7 and also K6 is good point if the ankle edema is there, pedal edema is there because of the hypertension edema, even that condition also advisable. Now we are stepping into the great point. Every day, number of the times, number of the patients, we normally see many patients, for most of the patients we apply the point, that point to be known as a folio. Folio means is the reverse current or recurrent, or the current is flows on that particular region. Now where that point is located, Tuchun proximal to the Tuchun proximal to the thigh cheek, K3 point on the anterior border of the Achilles tendon or the Tuchun anterior to the tibial bone. However, I'll make you comfortable to understand this point. Where is it located? You know K3 point is located here. Tuchun proximal to this point is K3 on the anterior border of the Achilles tendon. So now this is in fact is the great point to treat for all the kidney yang related disorders. Kidney yang related, that means the pericardium and also kidney. Further, it is strengthening to the renal system. In fact, this point is belongs to the mother point of the kidney. Belongs to the mother point of the kidney. K7 point is the folio. Folio is the point to be known as a mother point. Mother point means strengthening to the which organ? Kidneys. It is strengthening to the kidneys. When we wanted to strengthen the kidneys, so we can use the mother point as well of that particular organ or the particular meridian. So thereby we wanted to strengthen the kidney system. So I'll do the summary before stepping into that completion of the today's topic. But now we can understand K7 point is the folio point. But you wanted to know that the most of the people will be, if you wanted to accurately apply this needle, then every patient is advisable to obtain the current. When the current or the impulse should feel the patient, impulse should feel the patient should get the sensation, that sensation to be known as a till sole of the foot to be taken place, that to be known as a folio. So appropriately, that means you are connected to the tibial nerve. Which now you are connected? You touch it to the tibial nerve. The tibial nerve is responsible to flow of the energy to the entire sole of the foot. The people are suffering for the numbness on the leg region, that time insufficient of the blood flow to that region. Once you activate this point, certainly it will increase or enhance the flow of the energy to the lower portion. Make sure that each and every patient give the alertness to the patient that now you will get a small vibration, then you just give that alertness, then you just insert the needle. Patient feel drastically good changes. हाँ मेरी रग खुल गई. The people says sir रग दब गई है ना तो फिर थोड़ा खोल दो. People says कि open up my nerve. That time you just insert the needle, show them now the nerve has been opened. Then the patient mentally get the satisfaction, then definitely patient have the great impact. By the way, it's not the simple impact. This will be the mother point strengthening to that organ. K7 is the metal point or the air point connecting to the metal organ, that to be known as a pulmonary system. K7 is equivalent to the which point? Lungs 5, right? LU5. So LU5, what are the organ clock timing? 4 a.m. you can use it that point, or the K7, that means K7 point, morning 6 a.m. is advisable to activate this specific point. If you wanted to strengthen the kidneys, activate on time, particularly according to the circadian cycle, according to the biorhythm of the organ clock theory. You can use 2 points to strengthen the kidney at morning 6 a.m. Those points to be known as a K3 and then K7. Both the points can be activated on that specific time to strengthen the renal system is always is good. Hopefully you understand this point. Let me see that practical also. K7 is completed now, and then the K8 point to be known as a chioxin. Just 3 chun proximal to the tip of the medial malleolus on the anterior and posterior border of the tibia in the depression. The point is located is the spleen 6. 1 chun distal to the spleen 6. That area to be known as a lower Tanthian. That area to be known as a lower Tanthian. Tanthian ka matlab is not the point, but that area to be known as the reproductive area, renal area, spleen area, kidney area, and also liver area. Do you know spleen 6? Spleen, liver, kidney is the junction point. But here also the dioxin is the K8 point. But one author has written, perhaps 15 years ago I studied, there are the 2 particular points in the body to regulate our body system. 1 point, upper limbs to be regulated by the 1 point, that point to be known as the NEEC1, pericardium 6. The lower extremities can be regulated by activating the single point, that point to be known as a chioxin, that is the K8 point, where 1 chun distal to the spleen 6. Now you know spleen 6 having the broad spectrum of the indications you can treat, even including the diabetes mellitus you can use it. But you can use even for diabetes also this area of the point to be known as a K8 point is good point to treat for the connecting or the junction or communicating or the passage or the nexary point of 3 junction meridian, that to be known as a spleen, liver, kidney. 3 organs are communicating point to be known as a 2 points are existing. One is spleen 6, the second one is the K8. By mistake, if you applied rather than K6, many practitioners does a mistake, but they don't know where the spleen 6 point is accurately located, but an anatomical location it says, because you know the tuberosity of the medial tuberosity medial tuberosity of the tibia and also tip of the medial malleolus. How many chun proportional measurement? 13 chun. But 13 chun you divided on the, then you divided in the entire leg. That tip of the medial malleolus, from there 3 chun above to be known as a spleen 6. But sometimes we go on the spleen 6, we apply 4 chun above. Sometimes it's not 4 chun you are doing, but you are measuring from the malleolus, but you are not measuring from the tip of the medial malleolus. But however, that's the reason I told you we need some kind of the machine to identify the highest electrical conductivity to be taken place of the each and every acupuncture point. Still research is going on, but still I need Abdul Subhan bhai, you just tell me what exactly you have sent me some of the proposals. I think Dr. Kishore also here, I believe, but he also sent me some of the information. But we wanted to understand to know exactly how where the acupuncture points are located by using some kind of the machine and then tool we recognize. So accurately to understand the points. But however, according to the atlas of the acupuncture, the image of the acupuncture, and also according to the clinical text anatomical locations, but we are according to the Claudia Parks and then the Peter Deadman and many textbooks, and we could recognize that where exactly the anatomical location. But now the point is located 2 chun proximal to the tip of the medial malleolus and the posterior border of the tibia. This point is located, that point to be known as a Chaosin, that is K8. Now coming to the K9 point, I love this point, but all the girls should love this point. All the women practitioners will love this point. You will love, all of you? So now I give us a Hyderabad biryani, I don't know Madurai biryani. But however, so we'll give the anything, you just assume that. But K9 to be known as a Supin. Yes, there is a guest house. Where is the guest house is located? K9 point is 5 chun proximal to the K3. And then 2 chun anterior to the posterior border of the tibia. This point is located, that K8. However, you remember in the simple language, 5 chun above from the K3, directly vertically above the K3, 5 chun above, this point is located, that's called as a supin. But the supin is the majorly advisable to treat for the most of the pregnancy related disorders. That means post-pregnancy, not post-pregnancy, at the time of the pregnancy or at that second trimester and then is the third trimester, we should apply the needle as a acupressure, not as a acupuncture is not advisable. Remember, even yesterday I got the patient, I think you were there on that time, she said 4 months pregnancy, right? So that time she said, I do have the problem, she said, few problems she said, but however fourth month stepping into 5th month in the next month, but I recognized whatever problem she told, then I just applied the 2 points only to that lady. 1 point to be known as a NIC1, that is the pericardium 6 bilaterally I applied. If she will come in the month of next month on the better is on the 6th month, that means is the second trimester and then is the third trimester, is advisable to use this particular point. Either you can use the pressure or you can use the needling is advisable, but however giving the pressure is quite enough. Sir, what indications can be used? Dr. Mary Lustin, author, has written this. So we can use this point to treat for the heredity related disorders cannot be penetrated to the infant at the time of after the conception, right? The baby infant, that fetus is there, mother's womb, inside of the mother's womb, the fetus is there, the mother having the thyroid and father having the diabetes and mother having the diabetes and mother having some other related problem, that time it's not advisable. That means that hereditary gene related problem or sugar related issues, diabetes should not come to that baby.